Hi, everybody. Welcome to tonight's virtual event. I am Danielle. I am the community manager here at Calibrate. I am really excited tonight to be joined by one of our amazing doctors, Dr. Fawn Langerman. And I'll let her introduce herself a little bit shortly. But before we officially get started, I just wanted to share some housekeeping notes. So first off, we will be recording this event. So in case you missed something, or you know somebody who wanted to come who couldn't make it, or you had a question we didn't get to, we're going to be sending out a recap and with the recording in a few days following this event. So as long as you're registered, you should get that in your email. And then also we're going to leave about 10 or so minutes at the end for live questions and answers. So you feel free to use the Q&A section or the chat feature in Zoom to ask questions. I'll monitor that at the end and kind of scroll through to see some themes that we're seeing, and Fawn and I will answer those questions together. And great, so I want to first share with all of you guys what the agenda is for tonight. So first, I'm going to share a little bit about what Calibrate is, since I know there's a lot of people on this call who may not be familiar with what Calibrate is. I'll give you guys an overview of the one-year metabolic reset program. I will have Fawn introduce herself and share a little bit more about what she does. She'll also take us into kind of a deep dive about the metabolic health assessment, which is tonight's focus, what to expect, what you'll go through in that assessment, some things you should keep in mind, and why it's really different from any other doctor's appointment. And then lastly, I will wrap up and share with you guys a little bit about what happens after that in the process. And then, as I mentioned, we'll have our Q&A at the end. So to kick it off, what is Calibrate? So Calibrate is the first metabolic healthcare company that is changing the way the world treats weight through doctor-prescribed GLP-1 medications combined with intensive lifestyle intervention. And that is all through our app-based curriculum and one-on-one video coaching. Both of those things will lead to improved metabolic health markers as well as long-term sustained weight loss. So here's an overview of our one-year metabolic reset and the milestones that you have to go through as you begin the program. So once you sign up, you purchase. Then the first milestone after that is completing your comprehensive health intake. So the comprehensive health intake is something you will get in an email after purchasing. It is a questionnaire, and that's where you'll fill out all of your medical history, your weight history, your family history, and that's really, really important to fill out prior to your one-on-one video visit with a Calibrate doctor. That's because they'll want to go through all of that good stuff with you on the video live. The next milestone is getting your lab work done. Another important milestone to do before your doctor's appointment. And that is because, again, your doctor's going to want to review those results with you live. So we recommend about 5 business days from when to leave to get your lab work done, because you got to go to the lab, get it done, and then the results will be shared with our medical team for them to review with you live. The next step, milestone 3, is setting up your welcome kit in the Calibrate app. So once you purchase, about 5 business days after that, you will receive a package from us in the mail. That will contain the welcome kit. It will have your scale as well as some other fun stuff to help you get set up and ready for your Calibrate year. So there will be a packet in there that explains how to get your app set up and explain all the different tools that you'll need to be successful throughout your Calibrate year. The next milestone is what we're going to focus here on tonight, and that is the one-on-one Calibrate doctor's appointment. So this is a virtual appointment. It's about 45 minutes long, and it is the first big touch point with our Calibrate team. The last milestone is officially beginning your Calibrate year. So week 1 of your 52-week program doesn't actually begin until you begin your coaching sessions. So that first coaching session, which happens after your doctor's visit, that's your official start to your Calibrate year. So now I'm going to pass it over to Fawn. I'll let her introduce herself and share a little bit more about her background as well as what she does at Calibrate. As you can see up here, we have our Metabolic Health 4 Pillars Lightning Round. So what that is just so you guys can see a little bit more, get to know Fawn on a personal level, what her favorite food, her favorite sleep tip, her favorite exercise, and her favorite emotional health tip are, but I'll let her go into the details now. So Fawn, you can take it away.
Absolutely. Thanks, Danielle. That was a great overview. Welcome, everyone. Excited to see you and looking forward to meeting some of you going forward. I'm Fawn Langerman. I'm one of the Calibrate doctors. I am board certified in internal medicine. Started out prior to medicine with a significant history in quality and process improvement. And that's a very positive and process improvement type thing. It's a very positive thing. Went into medicine and ended up working in hospitals and in urgent care, which is not as positive, but came to Calibrate earlier this year. And it's an incredibly positive and forward-focused type of work, and I completely love it. Everyone has their why, and I'm incredibly glad to be here among people that are really passionate about wellness and improving metabolic health. That's a little bit about me.
Great, thank you. And then can you share a little bit about like what your day-to-day at Calibrate looks like?
Sure. So the group of physicians, we meet with patients for the Metabolic Health Assessment, which is truthfully the best part. Like Danielle said, we also work to move our members through the processes, including prescriptions and answering questions, and helping everything be situated. Yeah. The members. So there's a lot of work that gets done outside of the member appointments, but the member appointments are the best for sure.
So if you join Calibrate, you may have Fawn as your doctor. You may see it in your metabolic health assessment, which is awesome. Cool. So the next thing I wanted to do was ask you if you can define metabolic health for us, because this is something we're saying many times tonight, already have, and I feel like it's something we could all probably use a clear definition of. I know I can, for sure. So from a doctor's point of view, please share.
Absolutely. What's on the screen is a perfect summary of metabolic health. It's really how your body works. And we measure that. A lot of people say, well, it must just be the scale, but it's actually not. We measure that in multiple different ways. You can think of it kind of like a dashboard of how your body's working, kind of like you have a dashboard in your car. And so we look at lab values and things like your blood pressure and your waist circumference, and of course the scale. We look across all of those things, and we formulate that picture that helps us to understand your personal metabolic health. And what's fantastic about these one-on-one doctor's appointments is that they're longer than what you would have with your primary care doctor. In primary care, we get less than 10 minutes face-to-face with patients. At Calibrate, we get 45 minutes. That 45 minutes is entirely about you, which is fabulous. We're looking at your labs, we're talking about your history, we're understanding social stressors and where you are currently with your nutrition and your exercise and your sleep. We're looking at things that can help those processes and things that can be in the way, and we're setting you up for success for your Calibrate program, it's just fantastic. So the Metabolic Health Assessment will provide you with an understanding of your current metabolic health. And then as you progress through the program, we reassess your metabolic health at specific points in time. So you get an understanding of how you're improving your metabolic health. It's not just the scale, which is fantastic.
Yes, that's definitely super, super important. And I think one of the most rewarding things that I've seen at my time at Calibrate is those successes beyond the scale, for sure. Great. And then the next term I want to ask you to define is set point. What it is and how is it relevant to metabolic health and Calibrate?
Absolutely. Another great term. So the set point is the weight that your body wants to maintain. And wouldn't it be fantastic if your set point, my set point, if everyone's set point was in the normal body mass index range? We wouldn't be having this conversation, right? Because we wouldn't be fighting against a number that's higher than where we want to be. And unfortunately, that's the truth for a lot of us, is that our set points are higher than where we want to be. And the set points can change over time, just aging or in women menopause. These types of things can actually increase the set points. So it can be incredibly frustrating to attempt to lose weight because you're fighting against your body's natural intention to keep you at a weight that isn't your plan.
Mm-hmm. Sure. This was very much a light bulb moment for me once I understood this and how it fits into everyone's overall health. Super interesting. Great. Thank you. So super helpful. I would love to now pass it over to you to really dive into what the metabolic health assessment is. As we both mentioned, it's a 45-minute virtual visit with a Calibrate doctor, but I will let Fawn share some things to keep in mind and some things that you'll go through in the actual appointment.
Sure thing. So before you come to the appointment, you want to make sure that these things are completed. The comprehensive health intake, like Danielle mentioned, that is the nitty-gritty details of your background, and filling that out prior to the doctor's appointment allows us to come into your appointment and have all that information. We review that information before we see you, and we can read it really quickly. We'll have usually a few questions just to clarify, but the more information you provide in the intake, the less time we have to spend talking about stuff that you already know and that I can learn just from reading, and we can talk about the good stuff. So that comprehensive health intake is very important. The lab work, like Danielle mentioned, oh my gosh, so important, because we go through your labs line by line. We talk about every relevant piece of lab work that you've had, and we talk about how that relates to your metabolic health currently and how it can be improved through the program and through what you're going to do with your coaches. So definitely important to have that done. We do need you to be in the state where you reside for the appointment. It has to do with where doctors are licensed and where we can see you. So you definitely want to be in the state where you reside. And then you really want to be in a private space. What you want is, first of all, the ability for us to hear you and you to hear us. Secondly, you want to be able to talk openly and freely about your medical history without people around you that can hear it.
Sure. That makes sense. Very important. And then can you share what you'll cover? How?
Absolutely. So the actual 45-minute doctor's appointment itself is broken down into these 5 pieces. So first we start with how Calibrate was founded, a little bit of information about our background and our strategy. We then talk about your comprehensive health intake, your medical history, surgeries, medications that you're currently taking, allergies. All of that information will help us to determine what medications we can prescribe that are safe in your situation. In the third part, we talk about the pillars. So the pillars of metabolic health, we've kind of touched on a little bit already. You saw them in the little flash round, but nutrition, exercise, sleep, and emotional health. These pillars you'll be focusing on with your coaches throughout the program, but we get a baseline and we talk a little bit about where you are currently and how that relates to your overall current metabolic health. Then we go over your labs, like I mentioned, line by line, and talk about everything. And then we talk about next steps. Next steps include explaining medications that we can prescribe, side effects, things to expect from the medications, and we have a long conversation about how they work, which is fantastic. And then we answer any questions that you have, and then you're all set.
That's great. We'll go into the medications in a second, but before we do, I just wanted to ask you if you can share a little bit more about the lab work in terms of what labs are required and why those are really important for metabolic health.
Absolutely. So at a minimum, for us to be able to safely prescribe medication, there are three things that we need. We need an assessment of your kidney function, which is typically called creatinine, or the glomerular filtration rate, or GFR. So we need that. That has to be current within the past year. We need a thyroid stimulating hormone, or TSH, which is an understanding of how your thyroid or metabolism are working, and we need that to be current within the past 6 months. And the third thing that we need is either a hemoglobin A1C, which is a direct measurement for diabetes, or a fasting glucose. Both of those, either one is fine. Both is great, but either one of those also within the past 6 months. Now, in addition to those labs, we look, if you are able to provide them, we look across your liver function. We look at more about how your metabolism is working by looking at your insulin, your current insulin level. And we look at things like a high sensitivity C-reactive protein, or HSCRP, which is a measure of your metabolic risk, which is pretty cool.
Very cool. Great, thank you. Okay, so now can you tell us a little bit more about the GLP-1s, why Calibrate doctors prescribe them, how they work, why they are different from other medications people might have heard of before?
Sure thing. So a lot of weight loss medications increase the burn of calories in your body, which is not solving anything. It doesn't do anything for you long term. So we don't prescribe those types of medications. We predominantly use the GLP-1 medications, which are based, like this says, based on naturally occurring hormones that are in the GI tract. These hormones, when they're naturally occurring, these receptors tell your brain when you're full. And so the medications basically are a higher dose than what your body would normally have. It's the same type of chemical, but just a higher dose than you would normally have. And instead of just telling your brain you're full, it actually reduces hunger, which is fantastic. And as a side benefit, reduces your set point. And that's the key reason that we use the medication, because without reduction of set point, you can't get to the goal that you're attempting to achieve. And so the medications are used to reduce the set point and to reduce hunger, which is fantastic.
Yeah. And that's why we say at Calibrate, it's not about willpower, it's about biology. And that's a really perfect way to think about it in relationship to the medicine. And then also that, as I mentioned before, in combination with GLP-1s, the intensive lifestyle behavior. So what Fawn was talking about earlier, so making tiny tweaks in food, sleep, exercise, and emotional health that you'll work through with your Calibrate coach. The combination of those two is really where we've seen in a lot of research in academic institutions the most long-term success, which is really awesome. So not only weight loss, but also improved metabolic health markers. So improved A1C and insulin resistance, things like that. Great. Well, thank you so much. So I'm going to share, before we get to the Q&A, what happens after the Calibrate doctor's appointment. And so there's a couple different things that will happen simultaneously and begin to kick off after that first doctor's appointment. And the first thing is the support team, and along with our medical teams, will begin to work on the approval for your medication. So our support team is very experienced in getting GLP-1s covered. I have a feeling a lot of questions are going to start to come in on this topic. And so they'll work with your commercial insurance to help get coverage. So sometimes this process can take a little bit of time. It's really, really different for every person depending on so many different factors, but of course their insurance plays a role as well as their own health. Sometimes lab work that you've done initially is something that they'll have to submit on your behalf, or any information from your doctor in order to get coverage. But like I said, our team's very experienced about doing this, and they do a great job. And as they're working on that, you will also begin to progress through the Calibrate curriculum and the Calibrate app. So going through those 4 pillars of metabolic health that we mentioned, and there'll be lessons that'll be released in the app, and you'll progress through those along with beginning your coaching sessions. So there are 26 coaching sessions throughout the year. They're on a bi-weekly basis, and they're all video visits with your coach. So you will set up your coaching appointment. When you first join Calibrate, it'll be after your doctor's appointment, but that'll really kick off your Calibrate year, as I mentioned, week 1 of your 52-week program. And lastly, you will also continue to check in with the Calibrate medical team. Fawn hinted at this a little bit earlier, but at months 1, 3, 6, and 12 via the Calibrate app. So this is not a video visit. These will be check-ins in the form of a questionnaire that will come through the app. That being said, there is a medical channel in the Calibrate app where you can always reach out to our medical team to ask questions about your medication or any health-related issues that you'll need a doctor to answer. And they're always available as well to get on the phone if needed. And these questionnaires and these check-ins, as we say, are also really important, as Fawn mentioned, to see your improvements and where else there are opportunities to continue to improve and maybe make adjustments throughout your Calibrate 1-year metabolic reset. Okay, so that is everything we had on the agenda. We have like 9 or so minutes left. So I do see some questions starting to come in. So feel free to add a question if you have one. Okay, I'm looking at some of the questions. Okay, so one question is, can we do this program if you've already had weight loss surgery? And the answer is yes. Fawn may be able to add a little bit more detail to me, but the only requirement we have on our end is that it's been about 18 months since you've had that surgery. Fawn may be able to better explain why, but yes, you can't do Calibrate after that.
That's exactly right. 18 months minimum since the surgery. And then we talk a little bit about different surgeries and the effects that different surgeries have in the setting of the medications. But yeah, 18 months.
Yeah, for sure. Great. Okay. You can use FSA. Somebody asked, can I use FSA funds to pay for Calibrate? The answer to that is yes. Same with HSA funds. Okay, we have a couple questions that I think Fawn would be able to answer. That would be great. Do Calibrate doctors talk to your general practitioner or your PCP?
We don't talk directly, but we communicate in the way that doctors communicate, which is through a letter. So we format the letter when we meet you in the intake appointment, and the letter goes out when we determine exactly which GLP-1 medication you'll be able to take through your insurance. So that is the communication between us and your doctor.
Great. And then kind of like a little bit along that, can you tell us a little bit more about how the medical team looks in terms of, you have your assessment with the Calibrate doctor, but that's not necessarily going to be the person who is answering you in, the medical channel.
That's correct. We actually work as a group, as a team. We work in a collaboration. So the doctor that you see initially might not be the doctor that answers questions that you have, or even that refills prescriptions or helps you to change dosing of medication. And we work really closely together. We, of course, keep really good documentation so we can understand what's going on, but we do a lot of discussions back and forth to make sure that everything is seamless.
Great, thank you. Another question somebody asked is, can you share a little bit about the food philosophy at Calibrate, just like a high level of what that looks like?
Sure thing. And I would definitely defer to the coaches, but fundamentally, when you look at the rise of obesity and diabetes, particularly in the United States, it definitely tracks with the onset of the availability of processed food. And so we really have a very good focus on a reduction in processed food. And that is really one of the main things that you'll hear the coaches and the doctors talk about, is that.
Great. And then another question for you, Fawn. So somebody asked what GLP-1s are used, and I just thought that would be great for you to address,
Sure.
how that looks and how that's different for everybody.
Sure. So it really comes down to what your insurance company will approve. But the main medications that we use are Ozempic, Wegovy, Saxenda, Trulicity, and Rybelsus. And so a lot of people ask about Wegovy. So Wegovy is the new GLP-1. It's not new, but it was just FDA approved back in June. Wegovy and Ozempic are the same molecule, semaglutide. Ozempic's been around for over a decade. And Ozempic has 3 doses, 0.25 milligrams, 0.5 milligrams, and 1 milligram. And the vast majority of people, when you go up on the dose, the weight comes down. Yay, we get all excited. Things are good. But some people get to the maximum dose of a GLP-1 medication, Ozempic or one of the other ones, and they haven't lost as much weight as they want to lose. And that's why we have Wegovy. That's why Wegovy was FDA approved, because it has the same first 3 doses that I just mentioned that Ozempic has. And then it has 2 more doses, 1.7 milligrams and 2.4 milligrams. The higher the dose, the lower your set point, therefore the more weight you can lose. And so in some cases, when it's available and it works for your insurance company, we can start people on Wegovy and they go right through Wegovy their whole time at Calibrate. Some people are on a different GLP-1 and never need higher doses. And some people start out on one GLP-1 because of their insurance company and they switch to Wegovy when they max it out. So all of those routes are possible and they all work 100%.
Great, thank you. So another question that is coming up a couple times is about our coaches. So I wanted to share a little bit about our coaches. So they're accountability coaches. They're there to be your cheerleader, to help you throughout the program, but they're really there to hold you accountable. So their qualifications vary. They're all trained in the Calibrate program in our 4 pillars of metabolic health. So in food, our food program, and our sleep, emotional health, and exercise. So there's just a wide range of qualifications, but they are all really awesome and are really, a lot of the feedback we've heard from members has really been that their coach has been such a positive light and part of their experience, and really different from any other program they've done before, which is really, really great. And as I mentioned, you'll meet with them for 15 minutes on a bi-weekly basis, and talk with them about your progress, share some of your wins, share some of your setbacks, make some plans for how you can tackle the upcoming 2 weeks. And they're really, really great. Okay, and then there are also a lot of questions about when Calibrate will be available in your state. So I'm seeing like Massachusetts on here a few times. I think I saw Alaska, Rhode Island. So as Fawn mentioned, it is really important to, when you sign up, you have to be reside in a state that we're currently live in. Because there's a lot of rules and regulations around medical licenses for certain states. So we have doctors who are licensed in a variety of different states. So you're going to be assigned a doctor that's licensed in the state that you reside in. And so the reason why we're not necessarily launched in all states yet is because we're still working on many things, but one of them being getting doctors who are licensed to practice medicine, telemedicine in the states that we're not live in. So we are planning to be live in the remainder of the states we're not currently live in by the end of the year, which is coming up quickly. So all of you who are anxiously awaiting to join Calibrate, please just be a little more patient. I really appreciate all of your patience. I know you've been waiting a long, long time, but it's coming soon, I promise. And there's a lot more questions on here, and I know we didn't get up to all of them tonight, but I wanted to say as we wrap up, one, thank you guys all for coming, and thank you, Fawn, for being here. It was really, really great to have a face doctor and expert opinion on a lot of this stuff. There are a lot of questions about insurance coverage and how the medication gets approved and what our prices are. And so I really would encourage you all to visit our website, follow us on social media. You'll be able to find all of that stuff on our website, and you can always reach out to our team. If you go onto our website, we have a team ready there to answer any questions for you guys that you might have that we didn't cover tonight. And as I mentioned, we will also be sending out a recap. So look out for that in your email, and have a good night, everybody. Thank you so much. Bye. Thank you.